Aerodynamic diameter means the diameter of a sphere of unit density which behaves aerodynamically the same as the particle of the test substance. It is used to predict where particles of different size and density may be deposited in the respiratory tract. Particulate matter present in air is divided into different categories depending on the size of the particles or aerodynamic diameter or day. Based on the size, particles are referred to as 1. Coarse particle or PM10. These have an aerodynamic diameter less than 10 micrometer. 2. Fine particle or PM2.5. These have an aerodynamic diameter of less than 2.5 micrometer. 3. Ultrafine particle or PM0.1. These have an aerodynamic diameter of less than 0.1 micrometer. Let's have an electron microscopic vision of these tiny particles, and compare these to some identifiable substances for reference. For example, human hair, or grain of fine sand. You will realize that the PM10 particle is around 1/5 of the diameter of human hair and PM2.5 is around 1/4 the diameter of PM10 particle. Let's discuss how these may affect health at work. The potential for health risk from a particle is based on its size. Particles are categorized into 1. Inhalable, 2. Thoracic, and 3. Respirable, based on the size and their ability to penetrate various depths of respiratory tract. Inhalable particulates are coarse particles of aerodynamic diameter of over 100 microns. These are stuck in the upper airway and may cause rhinitis, nasal ulceration, or nasal carcinoma. Thoracic particulates have an aerodynamic diameter of less than 10 microns. These may penetrate the airways beyond the larynx, and may cause bronchitis, or bronchial carcinoma. Respirable particulates have an aerodynamic diameter of less than 4 micrometers. These fine particles pose the greatest health risk. They are further divided into fine particles, with size of up to 2.5 micrometers and ultrafine particles with a size of below 0.1 micrometers. Fine particles, or PM2.5, may penetrate low airways as well as alveoli to cause asthma, pneumoconiosis, alveolitis, or lung cancer. Ultrafine particles, or PM0.1, may penetrate bloodstream to cause cardiovascular, or cerebrovascular disease, for example heart attack, hypertension, Alzheimer's, or cognitive delay.